every third day there is some disaster in our country, whether it is terror attack, whether it is bomb blast, whether it is train blast, whether it is landslide. So disaster is there in any part of the country. When I remember bomb blast and the terror attack in Mumbai in 92-93, I saw the patients, at least 300-400 patients had come during that bomb blast. And the way the patients came to our hospital, it was just like luggage being transported in the buses. These were the best buses carrying those wounded patients, and it was a very pathetic situation.
Ran for quite a distance till I could not run anymore. Then there's someone who was passing in a sumo. 4-5 of us who were very severely burnt were put into the car, and we reached the hospital. They were not prepared for any disaster. This was 93 in Aurangabad.
The private hospitals and the civilian hospitals are not tuned to handle this mass casualties, 50 patients, 100 patients at stretch. Whereas the defense hospitals, they are geared up to have mass casualties, and they have a fixed set system, protocol to handle those type of casualties. Looking to this situation, I thought that we should start some forum, some system to improve the trauma care in our country. With that idea, I started this forum, NCTTC, National Counter-Terrorism Trauma Care.
Such a seminar, such as what is happening today, it talks about joint cooperation between the military and the civil. We have our own strengths, the civilian doctors have their own strengths. If we can put our strengths together, I'm sure we will be able to build a framework from where we can learn and make plans to tackle such major calamities as and when they have to happen.
The aim of National Counter-Terrorism Trauma Care is to train the medical and paramedical people to improve the trauma care in our country, to educate the public how they can help in any disaster happening in their presence. It is the public who is the first responder, who are the witnessing the event, and the people are getting injured. Now public should know, public should be educated that what they should do, what sort of first aid they can give to the patients, to the injured people, and save their life. With this aim and objective, we started this. During these 2 years, we had various activities in the form of symposiums, basic life support courses, lectures in various NGOs, various national and international platforms, and to the common public.
I'd like to say that the assistance of the armed forces are normally sought only when casualties are of a very large scale. This is because normally when such large casualties occur in any part of the country, sometimes it is not possible for the state machinery to cope up with the capacity of or the quantum of casualties that arise. Moreover, the armed forces are so structured that they are capable of a rapid response and dispatch of self-contained mobile and composite task forces to any part of the country or even overseas. After all, the ultimate aim is to provide total and holistic trauma care to the injured.
The most important activity which our forum is going to do is that we want a system to develop where an ordinary doctor is able to handle any sort of disaster which takes place, and this can be the part of their education, that disaster management should be the part of every medical student's education system.
I am from Sion Hospital, LTNGH. We have a trauma ICU which was started in the year 1973. And now we have a dedicated 14-bedded trauma ICU where we see on an average about 2,800 intensive care trauma every year. This is only ICU patients. So we have quite a bit of a training in our resident doctors and nurses have been trained in trauma. So who requires training? One, the paramedic, that is in the pre-hospital setup, so that a person should be trained to identify trauma, do the triage, start the initial resuscitation, and then transfer the patient. The nurses require training, the doctors require training, helpers and technicians managing trauma require training.
Dr. Begani, who is the founder of this NCTTC, is doing a very human service by coordinating the efforts of military and civil authorities in the formation of this counter-terrorism trauma care.
My message to the general public is that when there is such a major episode in your city or in the nation, we all have to gather together, be calm, help in casualty evacuation if we can, and volunteer to donate blood, because this is one thing that can save the life of a person. This is one thing which can't be bought off a shelf in the market.
This year, NCTTC, along with the Association of Medical Consultants Mumbai, has planned to do 50 basic life support courses to educate the medical and paramedical staff and general public about basic life support training. And this is how we are going to improve upon the trauma care. We are going to have a mock drill. We have planned very soon. We are planning this mock drill at maybe SL World, where several students and several visitors come, several thousand visitors come in single day, and just to have a mock drill, a demonstration that how a mishap takes place and how fast we can handle the situation. In Maharashtra state, once we can implement it properly, and then it can act as a pilot study, pilot project, and it can be copied all over the country.